This is a historic office hours. We're going to kick the day off together. And hopefully, your morning has started off well. I know in my home, we're adjusting to new school schedules and scenarios. So um, it's odd to adjust to new schedules in March, but I know that's what's happening in real time all over the place. So wherever you are in the world, I hope your day is launched well, and thanks for starting it with us today in office hours. Also, just appreciation for everyone's flexibility, confluence of schedules, and RSSL release yesterday made it so that it was best for flow for us to move office hours to this morning. So we're glad that you found us and joined us, and hopefully didn't create too many wrinkles in your lives and calendars, because we know how much you're juggling right now. Today's office hours, if you haven't joined us, the intention really is to provide clarity for you around RSSL guidance, particularly helpful when we've just had a new release. We want to create a space where your questions and ideas spark new thinking and solidify also what you're currently doing. We want to reinforce big anchor ideas and values related to the guidance, some related to COVID, others related to instruction and well-being of our children, and to create more of a sense of two-way dialogue that can be difficult with a state agency as large as we are. So today, Scott Nine and I will facilitate. Good morning, Scott Nine. And we're greeted as well with Ashley, Michelle, and Joanne, who are helping navigate details of chats and PowerPoint slides. So thank you so much. I know that Ken Greenbaum might be joining us, our digital learning director, Alexa Pearson, teaching and learning, and Dan Farley from assessment. So thank you, everybody, for joining us today. We're going to focus today on the RSSL guidance release yesterday and try to headline some key topics. So we've got a version of Colt Gill's slide deck that he shared with superintendents, ESD leaders, and charter school leaders yesterday. So if you met with Colt yesterday afternoon, this might have some redundancy to it, which can be helpful when we're understanding something new.
On with the comments already, huh?
I think somebody, Mark Stamler, if you could mute, please. Thank you so much. And we will try to be as responsive as we can be to you in the chat this morning. All right.
Anything there?
All right, just want to make sure. Thanks for muting. We appreciate it. We know it's hard. Sometimes those mute buttons can be tricky. And Scott, we can just kind of flow through this. We don't have Colt here, so all the slides that were supposed to be Colt, I don't know that we completely got clear about who is covering. So we can, I'll walk through this one and you do the next. How about that? So key updates for today, we're going to be reviewing Governor Brown's executive order, what's in it, what are the key headlines there to pay attention to. Who does it apply to and who doesn't it apply to? We know we've got private and public schools with us this morning. We'll give some RSSL guidance updates. So we'll include the metrics updated, reflecting the executive order, talk about cohorting, entry screening, face coverings as it relates to FAPE, visual and performing arts. We'll preview a new tool for you called the Hybrid Design Review Tool that we think will be helpful. And also talk about what might be on the horizon. So physical distancing, graduation pathways, graduation ceremonies guidance coming out this Friday, summer learning guidance and resources that we aim to have out by April 14. Everybody's asking about the statewide summative assessment waiver, so we'll give an update there. And then variables shaping the upcoming school year. Next slide.
So I'll jump in here. Good morning, everyone. And two quick invitations to add before covering the executive order. So if you were on yesterday's presentation with Director Gill, the benefit sometimes of hearing something a second time as you're digesting it and communicating it will hopefully be helpful. And we will do our best to kind of track questions in the chat as we go. We don't want to get too stuck so we don't move through all the information, but we can have a little more dialogue as we go related to slides. You'll see chat topics in the bottom right. and we'll try to kind of roughly stay on topic, but we can move through it. The governor released a new executive order 2106. We'll put a link to that in the chat, so you have the full thing. That happened last week. This guidance is in relationship to that order. And this slide just kind of highlights and formally mandates the governor's timing around the return to in-person instruction in hybrid or on-site, with some exclusions, including for private schools. And it applies to charter schools and public schools, but it also names what parts still apply to private schools, including all the RSSL health and safety protocols. It does put forward an expectation that CDL be offered to all families that want it through the year. That's CDL for public schools and public charter schools. And for private schools, the requirement is to offer a remote option. So it honors that private schools might have slightly different curricular ways to do that, but there's got to be some version of that. And it signals that state school funds are at stake in terms of compliance, and that it demands that ODE enforce the governor's order. We can go to the next slide. So in the architecture of RSSL, and we'll put the link to the full RSSL document, we've updated and really matched those governor's requirements, but tried to kind of then spell them out in more detail. I won't read the slide, but this just covers some of that same structure. I will note that we caught a mistake last night around this fourth bullet, and it's an error. So relatively soon today, you'll see that struck. The metrics are no longer advisory, and we caused a little confusion with that fourth bullet yesterday. So far, it's the only kind of quick patch mistake that we've caught, but just so you're not confused about that one, there was a last minute shift. The guidance puts forward allowance. This slide's actually out of date, so surveys were due at 5 p.m. yesterday. The good news is we got a 95% statewide response rate by 5 p.m. yesterday, so we feel very good about that. Good job, everybody, for your work, charter schools and public school districts, for getting that out. And we're working through rapidly our approach to contacting folks who either didn't respond or responded with a rationale that doesn't meet one of these allowances. But we've written out these allowances in the RSSL document that create a little bit of a buffering for basically being on track to meet the governor's overall goal and direction. Let me, we didn't actually pull in the.
Oh, sorry, Scott.
That's okay.
We
Let
can
me,
grab that.
well, or I can, give me just 1
Are
second.
you gonna grab it?
I can, I think I can, we can flip the screen share for just a second. Give me just 1 minute.
This is the way we actually like build a suspense and ensure engagement.
Well, I think probably at this point, have seen it. Well, actually here, sometimes it's helpful to show how you get to the things. So here's my screen, and we're gonna go with this one. Thumbs up if you can see my screen. All right, and then we're going to go to the RSSL webpage. I'm going to Health Metrics, and I'm going to Metrics Explainer, and it has the new updated Metrics Explainer, and I'll toss that link in the chat as well for everyone's. Oh, someone already got it. Thank you. So this turns the prior metrics model on its side. It's still the same basic metric structure, but it collapses the orange transition column. It returns the metrics in a place that makes it mandatory for public schools, school districts. You'll see this note at the top. It remains advisory for private schools. It notes in the top left corner that public schools must provide a CDL option for students and families that choose to remain off-site. And then it basically lays out the architecture of the governor's direction tied to what is still the kind of OHA advice. So if you are depending on if you're in a large or a medium or a small county, different things apply to you, same architecture. But K-12 must offer on-site or hybrid options for all grades if you're in the green. If you're in the yellow, elementary schools must offer in-person or hybrid options, on-site, fully on-site or hybrid options. Middle and highs are not required to open if you're in the yellow. But only, but if once open, which will come down to the blue box, they should only limit based on addressing transmission. And then if you're in the red, you may limit to CDO. We made this shift in the prior framework. The blue box doesn't look quite as cool graphically, but this bottom blue box in the table is really still very critical. It's like a tiny inch even more formal than before, but it basically, like the bottom line is like, once open, if you can continue to operate safely, stay open unless there is active transmission in the school. So basically what with the science has become really clear. It's actually, not only do we think it's beneficial for kids, but the routines and processes of safely operating and meeting all the protocols is better not to interrupt based on that outside community transmission. That's a big change from where we started from a year ago. But tied definitely to the kind of ongoing body of research about when the protocols are implemented with fidelity. But this basically just says, like, if you get open, you should continue unless there is transmission. Obviously, if there's transmission or your LPHA tells you to pause, you should. But that's important. So that's the basic metrics architecture in this version. We can jump back to the deck now, Joanne.
Scott, a quick question coming in private chat that might be helpful, and you might not know the answer to this, so full permission to be authentic and where what we know and what we don't know. But why did they get rid of the 50 case parameter to open? I'm just wondering, because our union was arguing for that to be the metric for opening. So thank you for any information you can provide.
Teach me what you mean by 50 case parameter. I don't know what that means.
I didn't know what that meant either, which is, but I assumed it was my.
Maybe someone can unmute and share.
Yeah.
I want to answer the question. I think it's good, but what does that mean?
Hey, this is Dandy. So if you think about the previous chart, when it was, I think it was the green column that if you had 50 or fewer cases per 100,000, you're full go.
I see. Why did they collapse the green into all into green? I see.
Exactly.
I understand what
Exactly.
you're saying. That makes sense to me. So the essentially what you see here, and you're right, really we should teach it as kind of like the orange and then the green is really an effort to kind of simplify and say what they think the kind of conditions are now. That, you know, essentially if the protocols, where transmission is below these levels, depending on small, medium, or large, and where the protocols are followed, we're now, and this is really tied to the governor's decision, like the governor's decision is tied to OHA advice and, you know, the review that's ongoing, just more and more mounting evidence that you can operate schools safely at these higher thresholds. And so it just reflects that shift. That times with the governor's move to say, you know, now's the time to go back towards in-person or on-site, but then this then mirrors that expectation that the conditions are now good. And so it basically it reflects what is really in the conversation between OHA and the governor's office. So really, you just think about like that threshold has moved in terms of the timing. So. Okay.
Thanks, Scott.
Yeah. You got this one, Jennifer? Or you want me to keep going?
You keep rolling.
Okay. All right. So another change in the guidance was the recommendation of cohorts was previously 24 to 36. Now it's just simplified to go up to 36, but it's 36 or less is still the recommended cohort size and design. But the threshold of a maximum of 100 has been eliminated. If people want more detail about why, I can do my best to describe that choice or threshold, but that is a shift in the guidance in terms of what's listed as both expectation or requirement in terms of this new guidance. Another change in the new guidance is to entry screening. So entry screening is an interesting one because we're actually here in some ways not following the science the other direction. The public health folks and the CDC have said that the kind of screening at the door at the beginning of the day doesn't have a lot of evidence that it's helpful. That's a confusing finding sometimes for people because their point isn't that it's not a good idea necessarily, it's that you actually need vigilance through the day, and a single moment in time at the door cannot be as helpful as vigilance throughout the day. And the other thing they found is that in places not called Oregon, people would do the entry screening all bunched up and grouped up with no distance, and it was actually being a source of spread. We have not done it that way, so it's hard to say that ours should really qualify. And we also think there's a lot of value in getting the day started off with rhythm and routine, and that builds strength and muscle for screening. So we really said we really wanted to try to preserve this, but we also recognize what all that science articulates. So we've maintained it as a requirement for elementary schools at this time. It remains a recommendation for everyone. For middle and high school, that offsite screening is okay. What that means is that screening at home before coming to school is okay, and staff like self-screening processes did not get changed. But that is an adjustment in this guidance in terms of school operations. If you wanted to make it, you're certainly welcome to keep the recommendation. Another part of this guidance that we released is, and someone will put the direct link in the chat as well. We had been getting consistent questions on what is, I think, a real significant operational challenge: deep commitment to inclusion and modification, accommodation, and adapting learning environments for students with disabilities or medical conditions, especially in a case where face coverings are difficult or impossible to utilize, and how that is held when the things that would accommodate a student might create public health conditions that are challenging for other students in the classroom or educators. And what process do you go through that honors legal requirements and expectations, the spirit of inclusion, and wrestles with public health? You really should not just rest with these couple of bullets. The real important thing here, this is 4 pages of deeply technical guidance. Director Gill, when he presented it yesterday, said we've done something that's not really, we scoured the country to try to find answers to this question. We've back checked with the Office of Civil Rights, the U.S. Department of Education, and we've tried to craft the clearest guidance we can to help you and your IEP and 504 teams work through these questions and come to your own determination on a case-by-case basis. We can't give you a one-size-fits-all answer, but we have gone as deep as we can into this challenge. So we really hope you'll give that close attention, especially as we're bringing more students back to in-person learning. Let me take one quick pause in the chat and just close the thing I just caught with Darcy out of the corner of my eye. Contact tracing logs are still absolutely essential, Darcy. They're still a requirement no matter how you structure them. And that's pivotal in terms of any potential outbreak. So no confusion about the importance of contact logs. Your design about how you do them has a bit more flexibility, but you absolutely still need them. Another one on visual and performing arts. This had been an area of significant confusion, the last iteration in particular. We've reordered the document. We've linked, someone will put the direct link in the chat as well. We've clearly aligned it to the governor and OHA's indoor and outdoor entertainment guidance and youth program guidance, trying to head towards alignment with those sectors. We've just tried to make it more readable. We tried to get the headlines at the top of the document. What's really critical that folks understand in this iteration, students are now allowed to sing indoors with face covering securely on and at least 6 feet of distance. They should not face each other. And the recommendation is that this happen outdoors whenever possible. And very similarly, wind instruments, there's a typo here on the deck, but wind instruments, anything you blow air through, so it includes brass instruments. There's technical detail about how to remove a face covering and play the instrument. And then we've also addressed capacity questions. So this is I think, hopefully much clearer than the last round, but will again be worthy of close detail and review. All right, Jennifer, you're up.
All right, I'm getting pinged from Alexa. She's saying, I think we need to loop back to screening. So Alexa, I don't know what you're flagging
Okay.
or seeing, but we're gonna unmute and let us know what you think would be helpful to speak to.
There is a question in private chat just around the screenings that for elementary, are they recommended or is those required? Because I think you had talked about
Required for
required.
elementary. They remain required for elementary. They are recommended for middle and high school, but it is allowed to do them offsite for middle and high school, but entry screening remains required for elementary school.
And Ben is asking, what's an example of offsite screening? So I think some folks we've heard have an app feature. Others are just sending it home and saying, here's some best practices. Encouraging families and caregivers to be extra attentive with their children. I know I've got a 13-year-old at home, and he kind of wakes up, and I'm like, hey, do you need breakfast? And he's pretty self-sufficient. My younger child, I'm much more eyes on, hands on. So just helping parents and caregivers cue more into how their kid's doing in the morning, helping the student themselves know what to attend to. How's my head feeling? Do I have any symptoms? Do I feel like I am feverish at all? So I think it's just teaching that awareness for the family and caregivers, and most importantly, the student to self-identify. And again, if entry screening is a practice that you want to sustain at secondary level, by all means, you may do that. So it gets a little confusing when we're saying that it's no longer required. It certainly doesn't indicate that it isn't recommended. And the last thing I want to say about screening is, I know when Governor Brown and Colt Gill had a chance to go to Portland and observe entry screening in real time at an elementary school, one of the things they remarked is just what a wonderful ritual it was. And as a prior elementary school principal, like the highlight of my day was standing outside of the door and greeting kids. So I think any way that you can connect a relational morning greeting with the entry screening and help, greet children eye to eye and see them and help in, just engender that sense of, welcome, we've been waiting for you. It's so good to have you here today. That also is an important piece. And when children feel seen, that's when they self-disclose, like, my tummy doesn't feel good, or I have a really bad headache, Mrs. Patterson. So just remember that, there is an incredible connection between care and screening around health and well-being for our youngest children. So the more that you can, the less routinized they can become and the more personal they can be, the more everyone benefits. All right, did we cover screening? Yes, temperature taking. Sorry, I'm probably adding details that might be confusing. All right, and Emily, I know you're saying that we've got people in the waiting room, but I don't know. I think we're working on solving it. So thanks for letting us know that. All right, we're going to transition to hybrid design review. We have heard lots of feedback around hybrid instructional model. And we know for sure, both from your feedback, from people who have been doing it, from what we're reading in news articles, as well as a limited amount of research, hybrid design can be very complicated to navigate, plan, and pull off well, particularly when it comes to the actual touchstone that students get with teachers and the amount of time that they have with learning and with one another. So we wanted to create a document that was a helpful tool for you wherever you may be in execution of hybrid. So some of you, again, are well practiced with this, you've been doing it, Some of you are just getting ready to launch, and some of you are just in that planning space. So wherever you are, we believe that this tool will offer something to you. So we encourage you to take a look, and we'll put it in the chat here as well. But the tool really features 4 components. The first component is helping to see hybrid on a continuum. So this visual that you see here that goes from the white on site all the way to the deep dark blue in CDL is intended to illustrate what we know to be true about hybrid, which is it's very broad and it allows for a lot of variation in what you design for. You've got folks that are doing morning shifts 5 days a week. You've got some hybrid models where kids only come on site 1 day a week, and everything in between. So please recognize that you have a lot of latitude in designing a hybrid model that is best aligned for what you're able to provide and offer and do well for children. Always, of course, we're interested in how we maximize on-site experience for children. So that in-person learning, we know there's no substitute or replacement for it. But we also know that you're juggling lots of other variables that you have to consider in terms of facility and space and staffing, and those things count very much as well. To help you further, we've got a section that's brief and easy around essential hybrid design questions. These are great to use whether, again, you're in the active process of design, or if you're talking to your community or you're addressing your school board and you need to say, hey, these are some checkpoints that we were really deliberate and intentional about in planning and execution for hybrid. So you can use them sort of in the rearview mirror or going forward. There is a component of the document that I think has like the richest gold. So spend time in there if you're interested. It's the additional design elements. So we really dive deep into 4 key parts: staffing, supporting students and families, scheduling and grouping, and most importantly, instructional design, to really offer considerations. Again, this is not guidance. It's just a helpful tool for you. Things that would be important headlines for you to think about, be curious about. And then there's resources embedded in there. So links to local Oregon examples of what's going well or what things might look like, how they might take shape. And we think this is a place where you'll find lots of information. And then a short section of additional links and resources that we've pulled together for you. So in total, this is a skinny document. We hope it offers lots of good support for you in your thinking, your planning, and your implementation. Anything in the chat, Scott, to address related to hybrid, or we're good to go?
Not related to hybrid that I've spotted. I wanted to just do one quick back step to, I don't know if I'm saying your name correctly, Shuka.
Mm-hmm.
For elementary school, the sign you describe as being screening would not be sufficient. For middle or high school, it could be a good idea, a good like secondary reinforcer, but it wouldn't quite match the expectation is the guidance. I hope that's clear, but we can follow up if you have more questions, but I just wanted to flag that one. Oh, Jennifer, sorry, you'd already
Yeah, that's okay.
That one.
It's helpful.
And Lori Perkins asked a question about aerosolization and tracheal suctioning. And
we cover that.
Lori, that is the guidance in that supplement, that it's not just that one specific issue, but that is the type of thing that we're very much wrestling with. And hopefully that new guidance will really help you there. And then Kurt Scholl on CDC, you're asking about if the CDC, so here we are. I'll use that as the transition point to this guide. So quite a bit of chatter and the press conference with Governor Brown, including Dr. Seidlinger, the state's chief epidemiologist, basically kind of talking about where the evidence is at, what's emerging with some new studies. This was covered in another Oregonian article today, and again last Friday. We can put the link to the Friday one here. This has an area of significant conversation with OHA, Governor Brown, and us. And you'll see that we made the determination to keep the guidance at 6 feet. So that remains the expectation. So one thing that happens in communications is people can kind of take away the absolute value. So this is not a change to 3 feet. The guidance is 6 feet. This is helping communicate why it's still 6 feet and where the conversation lives. Also, to be clear, physical distancing in 6 feet is directly connected to the 35 square feet in a room. So people have often, those are kind of connected variables. Kurt, to answer your question directly, I can't say what OHA or Governor Brown would do for sure. That's not I can't predict that or say that within my job capacity. I will say they're very aware of it. They're very aware of the CDC saying they'll study. It's unclear on timing, and it's unclear in some of the studies what's actually being discovered. So like even the new Massachusetts study, it describes 3 feet, but they make clear that most of the time in practice, it's much more distance. So it's a area that everyone obviously knows is a huge driver logistically for schools. And if it becomes very clear that it is safe to be at 3 feet with face coverings, and it really is, all of the research is about face coverings securely, properly worn. If that gets really clear, I would think that things could change. The timing of that, summer to fall to the few weeks, I really don't know, and it really depends on how that research shapes up. For now, we wanted to acknowledge that that was a real conversation, and that we're tracking it, and also just to make clear that for now it's still 6 feet. You want to take this one, Jennifer?
Yeah, absolutely. I just also want to name that the questions around what will be true for next year. So just to be clear, we don't know. So I know people are wanting and needing to anticipate what's on the horizon. And really we can't speculate, and we don't know. What we do know is that the 6 feet rule has not changed. And there's likely a lot to be learned. And as you can read in the media, this is a hot topic of conversation and study currently, related to, of course, bringing students back.
Let me pick up on that too. I just want to, respectfully, I'm saying it strongly so that it's clear, Benjamin, not personally, but at the top of RSSL, there's an authority section that makes very clear that it's RSSL that needs to be followed. RSSL's health and safety protocols for all schools in Oregon, public, private, charter. Other aspects are sometimes variable, but you can't cite the WHO. You can't cite some other entity. You have to follow RSSL. In terms of meeting the state's laws and expectations and following the governor's executive order. If you make other choices than that, then we get back into the world of compliance and OSHA from a health and safety standpoint, but there is not, you can't just point to a different authority. I just want to be really clear about that.
Yeah, I appreciate that, Scott. Also just want to create some real space for good tension in the air, because we recognize that there's a lot of sentiment and confusion genuinely around where RSSL was going to land, and what particularly was going to happen around physical distancing. So John, appreciate that you listened well to what Colt said last week, and also just absolutely want to be super clear that he, along with all of us, are navigating a very complex landscape that shifts and changes in terms of every day we're learning something new. Every day the conversation holds a richer dynamic, and I think that I want to just put your disappointment in the room and name it, and you're not alone in that sentiment, and also want to be clear that I think this is something that we're trying to signal is a conversation that will continue with OHA. Scott, specifically to his question in terms of feedback.
Thank you. I appreciate that. I appreciate what you just said. And John, I hear you, like, what I think is most important to say is I will never tell anyone to not advocate for whatever they feel their position should be, or to write anybody. I hope they'll write professionally or thoughtfully or mindfully. And I can definitely tell you that that doesn't always happen. And there are some pretty horrific emails that get sent to leaders in the state that we don't talk enough about, that are personal and very painful to read. That said, lots of passion. Everyone cares about their kids, lots of perspectives. But I will say, Dr. Seilinger, Governor Brown's office, like, no one's confused about the tensions or the goals or the needs. And another email pressuring them or telling them what it should or shouldn't be is not actually a fact. Like, it always is good for people to share their perspective or email or information, but it's not like the volume of email is what's going to change the decision. It's a choice point between where the research is, where the research could be, what's happening in terms of what's playing out in Oregon, and then trying to figure out what keeps everybody safe while getting back to in-person as soon as possible. And there's lots of hard decisions that happen. This was a very hard decision. It remains a hard decision. And it's really about how do you best interpret. And at the end of the day, final decisions live between OHA, the governor's office, and ODE. And that's where the decision lies. I'm not sure that sending emails targeting any one person is really the right probably thing that will move that dial, as much as waiting for the next information from the CDC or other research to compile to move that. But hopefully that answers your question. But I don't want to, if you want to write people, write people.
Yeah, and also, in the spirit of, this being a two-way conversation, again, there are 230 people here with us, so it's a little challenging to do, but full invitation to put what feels true for you in the chat, because it informs us. It's important that we hear each other and that we hold space and create space for what feels real for you and your context and in this moment. And we also recognize that there's a wide variety even within this space and very different perspectives around many topics that we're talking about today.
Okay, maybe we should finish getting through the deck and then loop
Let's
back
do
on.
it. Okay, I know it's hard to go from physical distancing.
I know.
A little rough, but I'm gonna take us there. So just a couple of headlines. We know that you are looking very, very critically to the end of the year at this point, and graduation, if you're at the secondary level, is front and center in that focus. So just a headline that we will be releasing Graduation Pathways 2021 and Ceremonies Guidance by March 19. So you'll have that in hand. Some key big takeaways for graduation. This should not be new news, but just to say it again is if helpful. Credit requirements remain the same. And we encourage as much flexibility as possible through credit earning options. Some of you require more than the 24 credits. So if you want to require more credits, you may do that. That's a local decision, but you can't require fewer than 24. We are in process. This hasn't yet been waived, but we anticipate that essential skills and personal learning will be officially waived by the state board. And prioritizing on-site learning and support for seniors. You know what, I just misspoke. That has been waived for this year. We're in process of waiving it for the following year. So let me correct myself there. And then we will base our graduation ceremonies guidance on indoor and outdoor entertainment establishment guidance, and likely connected as well to the statewide county risk levels, similar to athletics. All right, summer learning, this is big news. And there will be a significant investment, likely. It has yet to land officially, but it's certainly in process. The legislature currently, Governor Brown testified yesterday to the Ways and Means Committee, along with some senior legislative leadership. So we are looking at a significant investment in summer learning and childcare. There are a lot of details still to be worked out. It will run through districts, and so it does apply to charter schools, but districts will distribute it. It is not, as we know it or anticipate it, will not fund summer learning opportunities for private programs, private schools. And the key idea here is, how do we capture as many children as possible on site? So the only option for this investment is on-site learning. And what might that look like? How do we create as many interesting, engaging ways to get kids back in school and their minds and their bodies active? So a focus on enrichment, also connected to, core academic learning, career-related learning, encouraging lots of creativity. And I'm hopeful that this will look very different than a sort of, traditional skill-based summer school effort. So we're excited there. You can see that Governor Brown's tweet on March 8th talks about sparking joy, fostering creativity, and encouraging healing. So I think those are beautiful words to hold on to as we learn more about what this will and will be. We're going to release guidance on April 14th. It will include health and safety protocols. It will include some resources around how to design for this. There'll be a big emphasis on high school credit recovery options, how to do those well, and what options exist for you. We'll focus on our emerging bilingual children, our connect to migrant existing programs, as well as children that experience disabilities will be an important focus. And lastly, just really working to focus in on transition years, because we know that K-1 transition, 5-6 transition, 8-9 transition are really critical for students. In terms of resources, there will be a possible state matching plan through reimbursement. And we know that the biggest challenges that you're likely thinking about is related to workforce. So we've heard that clearly, and to the extent possible, we will be in conversation with you around some creative possibilities, some creative solutions, and recognize that this is exciting, and also there's some real challenges in terms of how to make this happen in real time, in short order, on the heels of a year that has taken the best of us. Assessment waiver. I think we have Dan here. Dan, do you want to speak a little bit about this waiver to the group and where we are?
Yeah, so we, of course, don't have a final decision from the United States Department of Education is the headline, I guess, if you're not burying the lead. We had a meeting, an informal meeting with U.S. Department of Education representatives last week, and are expecting and scheduling another for this week. So the conversations are ongoing. We've done what we can to provide our district test coordinators with the resources that they might need if indeed Oregon is expected to proceed with summative assessment this spring, but the decision is not final yet. So I think that's the update that we have. The other commitment is we've of course made the Student Educational Equity Development Survey available for a pilot this year, and we're committed to that irrespective of what happens with the waiver. So it'll be seed survey only, seed survey plus summative are the options that we're trying to prepare for this spring. And the assessment window has been shifted to April 13th through June 11th. So we moved the assessment window to give more time for training if necessary. We also have shortened blueprints across the board. So all of our general and alternate assessments will be much shorter this year if required. And substantially shorter, meaning a reduction of 67% testing time. So substantial reduction in testing time.
Thank you, Dan. I just want to appreciate Dan's done a lot of listening and a lot of really critical leadership, starting way back at the very beginning of this school year. Number one, designing a shortened test blueprint. That might sound simple. It's really complicated, and there was a lot to execute to make that happen. And also, most importantly, really working collaboratively with many voices in the state to put forward one of the first waivers nationally that's been an example for many other states. So just appreciation, Dan, for your continued leadership on that front. Okay, let's switch, Scott 9 to variable shaping guidance for the coming school year.
Great. This is we had been asked pretty consistently about, I'm going to put the link to this in the chat, kind of to help forecast for people what's going to shape really summer and fall. And as folks are making plans and staffing and budgeting decisions. And so what Jennifer, well, you can keep going, Joanne, to catch these. What this document does is break down what are the variables, what are the constants, and what are other considerations. And while it will not answer like definitively, here's what it will be, I think it does a pretty good job touring. Each item has a bit of a couple of sentences, really giving you a framework that from our perspective, along with OHA and the governor's office, is kind of like what we're constantly looping ourselves through, and gives you the best guide by which I would think you might want to kind of think through how this plays out in your own specific region or community or context. So you might have your own kind of version of this. I understand that many folks might need to have, more than one plan. We're all hoping very much so. You'll see the very first variable being variance. If you're following the news closely, you saw Dr. Fauci send a big awareness move a couple of days ago about us potentially lagging Europe, and consistently being a few weeks behind them, but trying to name that we're not out of the range of new variants. And we're all hoping he's wrong. I'm sure he's probably hoping he's wrong. And we need to remain kind of humble and vigilant while trying to also deal with what's in front of us. And what we are looking at is really consistently declining numbers, vaccinations, and we don't do a lot of what's called genomic sequencing in the US. And so it's hard to know where we actually stand. And so we need really for people to have some range, but we are moving based on what we see in the numbers. And then we're also moving in ways in which we understand the protocols are very effective. Face coverings, we name as a constant because they're not going to go anywhere. Young people are not going to have been vaccinated. Not all of the educator workforce is vaccinated. Everyone who wants a vaccine and educators has had a chance to get a first vaccine. Most are moving towards 2, but we have some significant vaccine hesitancy that we need to be honest about. But face coverings are absolute protection. Good, clear, strong, full working face coverings. That's not going to go anywhere. You should plan that. If you have the illusion that you're going to open in the fall without people wearing face coverings, we want to break that illusion for you. Physical distancing is going to be a constant. The size distance might change, but it's a constant. So we name in there that it could shift. COVID testing will remain a constant. But then we also get into what are other important considerations. What did we actually learn about good teaching and learning, and how does that impact? And so we're working at framing and thinking through what is the role of state guidance for the summer? What is the role of state guidance for the fall? How much of this architecture remains and how much of it is time to release and let go of? We don't have answers to that yet, but we know you need to plan. So we tried to give you a guide to kind of the key factors that will shape our thinking ahead of when we'll actually produce the guidance that would shape the summer or fall. Jennifer, anything you want to add to that?
No, I just put some of McKenna's artwork, a panda with a face mask, in the chat to add a little levity to the conversation, and bring our children into this space because it's beautiful. I think there's been some private chat conversation around how we build culture around face covering, and how we do it in a way that creates consistency and care. And just like anything, any ritual or any expectation we build in schools, the approach we take around it really matters. So I think anytime we can grab children's voice and children's sense of how they're seeing the world, helps us. It helps us do that better. So just a reminder that children and students can also really help lead the way in shifts and consistency toward new patterns. I don't want to diminish where people are really feeling stuck and frustrated around this 3 feet, 6 feet. I don't know what else we have to say around it, or how else we could bring voice to it that would feel satisfying. My sense is, nothing short of shifting it to 3 feet, and the guidance probably will feel satisfying for some people based on where they are and where their context, what their context is informing them. But I do want to name Kurt, that we hear you and acknowledge that it's still not landing. It's still feeling like we aren't doing as much as we can to maximize getting students on site. So
Can I ask a question?
mhm.
If we prioritize educators, if there's research about staff being safe because of vaccinations, they've been given the opportunity, that seems like that should be a part of the conversation that I haven't seen a lot of discussion about that, and that's not being promoted as much. And so it feels like we're kind of sidestepping the discussion to some degree about a state prioritization. Again, I have a sister-in-law who had breast cancer. Educators got vaccinated before she did, and because of her age. So if that's our priority, let's start talking about what that means to having a safe workforce and access to kids.
Thanks, Kurt. The feedback super received. You will know, I know that this won't, I'm not trying to fully satisfy your concern, and can take the point on message and pass it along as well. You will see in the variables document, which got a little missed, when it first came out 10 days ago, which is why we're kind of re-elevating it. We specifically name what you just described. So we named the impact of a vaccinated workforce, and in some ways, as importantly, vaccinated elders, because a lot of the most lethal risk diminishes as those elders are vaccinated. The crosswind is still the kind of fuzzy science around the new variants. And it seems like the vaccines are going to hold up on lethality, but that science is not clear. So they're in some tension there. And there's some pause for OHA around that. And I can't speak for them. I'm just trying to translate and communicate the variables as I see them. But I don't think you're wrong. And I think a big part of the governor's decision to say, now is time to move. And she wrote that in her first letter of direction and in the memo about the prioritization of educators as part of what is the return. I hear you on the 3 feet, 6 feet part, so your point's really well taken, but you'll find in that variables document some language that points right at what you're saying now. Alexa, I put something in the chat about the screening, but does more need to be said about that, or did that cover it?
Nope, I think that one covered it. The one that we have from earlier on that I don't think addressed, and maybe I missed it, was around travel.
Okay.
And so I want to make sure.
What was the question?
In November, Colt Gill said schools should enforce the travel advisory. Is that still recommended?
So the travel advisory was updated, teammates, 2-3 weeks ago. We can try to pull it in off the web, off of OHA's website. It remains in effect. It was adjusted, and it was specifically adjusted around vaccines. If vaccinated, both jabs and 14 days and no symptoms, there is no need for the kind of what's called a kind of preventive or proactive quarantine as it relates to travel. That is advisory, meaning it is not a requirement. I know many employers trying to follow the governor's guide at the time that first happened chose to operationalize that, and that is still the hope, but it's not a formal requirement. So as a kind of employer or workforce entity, it's really your call about that. Thanks for pulling in the link to advisory. So the where that makes sense to you and you can integrate it and you can update to that, the hope would be that you would. That's our best advice from a state perspective. But you do have, it is advisory and a recommendation. There's no forcing action. It's not a formal requirement for you to implement.
There's these conversations around what about face masks? Will they always be required? And so I want to be really clear that the spirit that we try to engender in these meetings are really, we're speaking into a space saying, this is what we know in the moment. This is our best prediction. This is what we can anticipate. And what we also ask you to understand, and you lead in the same space that we're leading in, is that things are shifting. You know, what we knew, I was just laughing with some colleagues around how just what we've learned in a year and what we knew about the disease a year ago, what we know now. And so there's been a lot of shifts. There will continue to be a lot of shifts. So it's not realistic for us to be able to answer a question for you around, will masks always be required? We don't know that. But again, our most informed perspective would lead us to believe that masks will likely be required into the future, and because they're so preventative. So it doesn't really help at some point to keep pushing at those questions for us, because we're trying to be as truthful with you and really transparent around what we know and what we can predict. And unfortunately, we don't have crystal balls. So just want to ask for your grace around that.
Sherry, I put a comment in the chat for you about that to build on Jennifer, but I appreciate the, like, we need goals and positivity. And I do agree that we need to be able to see ourselves like through the tunnel of this and be able to imagine those things. And I'm a big believer in this idea that like leadership is like tell the truth and point to hope. So like we do need that. We need to be able to know that we're going to come through this at some point. And we don't want to tease or mislead people or give like a false construction that sets people up for disappointment, where you go like, oh, it's all going to be good in the fall. And so I think part of your all's role is to actually prepare your staff and your community for what we hope would be a changing fall. We'd hope in the fall, we'd be saying, hey, like we're really almost through this. I know that President Biden gave this speech about July 1. We're really just in this place of trying to attend to all these variables and variants, and we're wanting to be very clear about what you should set the norm around, and then we'll be delighted if it comes faster. I certainly don't think it will be for forever. So I really appreciate the point of that, but we are trying to find the right balance.
Yeah, and I just want to echo what Scott said about the variant. There, you know, I think we're trying to hold space about not, you know, we don't want to be too certain that we're out of the woods just yet. And so I think that's, you know, tempering our thinking and trying to be honest with you all around that. And also recognizing, you know, I mean, my husband said, gosh, wearing a mask for 7 days at school is really a bummer. And so we get that. I mean, there are components of mask wearing that really influence and affect how we see each other, how we communicate, how we feel around each other. And it's a drag. It's not intuitive. And as educators, we are wired to connect with one another, and seeing our full faces, being close to one another. We recognize how, really how primal that is to our existence and how much it means to behave in those natural ways. So we're not trying to suggest that any of this is intuitive, easy, or preferred.
Can I close with a quick story, Jennifer?
Oh, please.
It's tied to what you're just saying. So I have a 10-year-old daughter, and a couple of weeks ago, she was in a pretty down place. Just like all of the things of the pandemic were really hitting her, and I just paused for a moment. And sometimes you just need to like get alongside with where everyone else. And I was like, you're right. Like this pandemic sucks. So like this is all terrible. Like it is so bad. This is so exhausting. It is so frustrating. Like this pandemic is dumb. And like she teared up, and then we spent like 5 minutes just talking about how dumb a pandemic is. And I just think like, we have to be able to hold the range of like, this sucks. It's not what anyone thinks is a good idea. And like, here we are. We haven't all done this in 100 years. And I think in the big scheme of things, we're probably doing all right, but we know everyone's exhausted and tired. We are too. So hopefully we're providing you the tools to help trying to kind of track through as best we can all the changes, but we're clear all around on the impact. So.
Yeah, and just deep appreciation for bringing your authentic selves to this space, and to the extent Zoom allows that. and for being brave about naming where you think we've got it wrong and where we need to continue to pay attention, where you think we've got it right. We certainly bring a tremendous amount of humility to the conversation and leading in this moment along with you. So deep appreciation for joining. We will not have office hours next Monday, so we will see you next on the 29th at 3 o'clock, and be well and take care. Thank you.